sometimes when you've got an organisation that has a very clear front line, like healthcare in the NHS, and then you work in a corporate support and development service, it can feel a little bit like you're disconnected from what the organisation's actually doing. And if, like me, you go home, people ask you what you do, sometimes they just kind of don't get it. But from my perspective, we're the engine room of this organisation. I feel like the teams in corporate support and development, if they don't do what they need to do, and I think we probably don't understand fully what they need to do on a day-to-day basis, the whole place will grind to a halt. So it's really simple things, isn't it? Like people get paid, we get goods and services into our buildings to enable us to do what we need to do for service users. The lights turn on, the buildings are secure, they're in a safe environment. You have access to training and development, systems that work and enable you to do what you need to do. And then from a subject that's close to my heart, you have information and access to information that you need. So for me, if you're in support and development, you can hold your head high and be really, really proud of all the contributions that you make to the organisation on a day-to-day basis.
Harry's been working really hard recently. Harry stands for Health, Advice, Recovery, Resilience and Information. And Harry goes out and about into communities to give them information on health, mental health, recovery, prevention and many, many other ways to engage with our communities.
Since the project started last year till now, we have seen over 2,500 people. The impact it has, we have managed to see over 400 people who had a walking stick, had a rubber change. We had people who had blood pressure check. We had people coming in with health issues. We had people coming in because of mental health issues. We had really helped people, and this is a great tool to go out in the community, to listen and help our community.
We started our listening interaction journey in July 2019, and we kicked it off by having a pulse check survey where over 4,000 of our staff provided some fantastic ideas for change. We managed to succeed in improving working lives by doing some of our quick wins, and we developed 15 teams for our Wave 1 improvements. We celebrated with a virtual Pass It On event earlier on in August. We had to change to virtual due to COVID-19 and obviously restrictions around social distancing.
In May and June 2019, 5 out of 14 core services were inspected by the CQC. Dental services were inspected for the first time and received an overall rating of good with outstanding for caring. Children's inpatient services, they also had a very positive report with an overall rating of good. However, the inspection of the adult acute mental health pathway resulted in a rating of inadequate for 2 of the core services inspected, which resulted in 2 warning notices being issued to the Trust by CQC. The development of a robust CQC action plan and the supporting governance processes enabled us as an organisation to begin our improvement plans. But the action plan was just a tool used to set down the improvements that were required. Staff across the organisation's clinical and support services delivered a number of improvements. These improvements were only made possible by all our hard work and dedication. A number of these improvements were recognised by CQC when they undertook a series of unannounced inspections between December and March. This resulted in both warning notices being lifted, which was a significant achievement. So whilst as an organisation, we still have a challenge ahead of us to improve our overall rating with CQC from good onwards to outstanding, it's important to just take a moment and reflect on the journey so far. There are some great examples of our staff delivering some significant outcomes for local people in a wide range of settings, and we should recognise these and talk about them. Not just because it's a good idea to make sure that external bodies such as CQC know what we are achieving, but because it's important to recognise and celebrate what we do and how we make a difference for our patients and their families and for each other.
Good morning everybody. My name's John Glover and I'm the Director of Digital at the Trust. I've only been here a relatively short period of time, but in that time people have been absolutely fantastic with me, brilliantly helpful and really open to new ideas and ways of doing things. But today is all about your successes over the last 12 months. And to put that into context, I think it's really important that we understand our role in corporate services and the impact that has on patient outcomes, on the patient experience, and also on the ability of our staff to be able to deliver their jobs directly facing with patients. You've individually and collectively risen to a generational challenge and can be really proud of all of the work that you've done to adapt, changing away from a face-to-face on-site model to an off-site and virtual model. And you've done that whilst also maintaining day-to-day services, which is just simply brilliant. Now going forwards, COVID's not gone away and the challenges are going to keep coming. We're going to have to continue to keep adapting and changing with lots of new things coming. We've got Rio, we've got a new dating system going in, we're putting in a new performance reporting system, a new intranet, a new website, so many new things that are coming that we're going to be part of. I hope you're enjoying this event and you use it to re-energise. You deserve it. Thanks very much for everything that you've done. It's really appreciated.
I'm from the Lancashire Recovery College and we're celebrating over 700 learners registered on our student database. We are now working with over 30 partners and we've grown our courses from an offer of 10 different courses to over 40 now.
We've been working with our transformation colleagues in Cumbria, Northumberland, Tyne and Wear, supporting all our clinicians in Pennine to redesign the community model of care. So we've held a series of workshops with patients, stakeholders, including the police and MWAS, and redesigned the community model. So we've looked at access, assessment, our pathways for psychosis, non-psychosis, and our pathways for older adults.
Hi, I would like to celebrate the development and implementation of the Trust's 3-year Reduced and Restricted Practice strategy, Think Person, Think Positive Practice. This really aims to improve patient experience, patient care and staff experience as well. The strategy is underpinned by the Trust's first large-scale quality improvement collaborative, which it covers 3 areas: restraint, seclusion and rapid tranquilisation, and is really driven at team level so that the people who are on the floor, shop floor, delivering the care, know what the issues are and know what the solutions are, that those are the people that are driving this forward. So thank you to everyone that's been involved so far, and I'm really looking forward to the next 12 months and seeing what we achieve.
We committed to setting up this service despite the challenges of COVID, and we have doubled our contacts month on month since May. Our PASS officers have begun assessing the inpatient units, reaching out to our patients and understanding their experience of care. And as soon as COVID allows, we will be making impact on the community side as well. I am very proud of how well we have worked this period, and I want to say a big thank you to every staff across the Trust who's put in their best this period.
I want to talk to you about how people with lived experience really make a difference to our organisation. Over the past 12 months, we've had lots of activity where people have been involved. People have been involved in our place assessment, which is the patient-led assessment of the care environment. And those volunteers have really helped go into areas to have a look at what the environment is where people are being cared for and help us to really drive and change that. People have also helped with work around child and adolescent mental health services. They've helped with the eating disorder pathway, as well as more recently with the personality disorder pathway in partnership with other organisations. So people do make a difference, and we need to have more and more people engaged with lived experience and their carers to really help us to drive quality across our organisation.
From a communications team perspective, it's probably one of the smallest teams in the Trust, and they cover a gigantic area, and that's both geographically but also from a functional point of view. So communications can be anything from online events and webinars to actual events to news, media, managing our reputation, all the graphic design stuff, the website, all of this stuff is all in the daily mix of communications. And some days we might be planning to be doing one thing and something else happens and we just kind of have to move with the kind of punches and go with it. I think we can be dealing with something in South Cumbria, which is a very different environment from somewhere in Southport and Formby. I have to always try and understand who our audience is, who we're trying to talk to, whether it's internal or external. So there's an enormous amount to think about, and it's a pretty small group of people. I think that has been exacerbated during COVID. So what I've been really proud of is within moments the team was embedded into the command support room. We were working 24/7. We'd never worked an out of hours rota before here at the Trust. We were doing all of that with very few conversations, without any real remuneration, without new contracts of any of that. It just needed to get done, and guess what it did? And within a few days we were issuing a daily update, and I know they came out very late some nights and they were 14 and 15 pages long, but we were completely committed to getting the very latest information to people because we knew they needed it. They needed that reassurance to know what is it they should be doing. But it's not to be underestimated, that was a huge undertaking for the Trust. And then I think as we moved through COVID and we grew in confidence, bringing people together with our colleagues in IT and within the Chief Exec's office into our Engage events that became online, and sharing all that good practice, pulling out all that hard work, making sure people knew they were recognised and valued. And I think that again is a real skill of the communications team. So what I want to say to the comms team is you're recognised and valued. We couldn't have done any of this without you. We couldn't have indeed done any of it without the whole of the corporate support effort. So thanks for everything you've done in 2020. I'm really proud to be part of this team, and I think you've done an amazing job.